He's very open about getting a haircut. I mean, I wish he was just more open about his transplant journey. I think it would help a lot of people. I wish celebrities were a little bit more open about some of the cosmetic surgeries that they get. I understand, you know, they want to protect their privacy, but it would help a lot of people to know that, you know, he had a transplant or 2 or 3 and what that's done for him. Hey guys, Dr. Gary here. So I'm going to do a reaction video to this video posted by Matt Dominance, and I've seen some of his material, and he's definitely a thoughtful guy, knows a lot about the hair world. He's not a surgeon, but he's an enthusiast. Let's watch this video on LeBron James's hair transplant, FUE, FUT, concealers and more from March 2021, because I've been hearing a lot about, you know, LeBron James and his hair, and can you comment on the hair? And I think Matt put together a nice video. So let me take a look at it and tell you guys what I think.
Welcome back to the channel where I'm going to be talking about LeBron James and how he got his hair back, his several hair transplants, FUE and FUT hair transplants, his hairline comebacks, several of them.
Oh yeah, look at this. You can see LeBron James there, and it's pretty clear that he's thinning quite a bit in the crown, mid-scalp, frontal area, and it looks like maybe he had a transplant just into this kind of frontal zone at the hairline, at least at this shot here.
When his hairline literally came back from the dead, then he lost his hair, and then the hairline came back again several years later. I'm going to be talking about that as well. I'm going to be talking about his use of concealers and hair fibers, which I think he's a big fan of. And talking about hair fibers, guys, this video has been brought to you by GoFiber, which are hair building fibers.
All right, we're gonna skip past this. I can appreciate people, you know, making money off the sponsored stuff, but I'm not sponsored by anyone, so we're just gonna fast forward on that.
Second important thing to do if you are considering a hair transplant in 2021, make sure you visit mattdominance.com, where you can get a bunch of free articles, one bead in Turkey, bead worldwide. Very good information. I highly recommend. So make sure you visit my website.
So I guess he's like a consultant for people interested in hair transplants. And I've spoken to Joe Tillman, Spencer Coburn, and, you know, and some others. And I think there is a role for people who are not transplant surgeons, but kind of serve as liaisons for patients considering transplant surgery, because it can be hard to figure out, like, where should you go, what are the important steps. And I still think that patients should feel comfortable finding a doctor and trusting that doctor for the primary advice. But from a surgeon's perspective, I don't have all the time in the world to sit with someone for hours discussing all of their options.
Approximately 10 hours later.
Consultations in my practice 30 minutes, they're, you know, packed full of information, but some people need even more time and they need to research more. And so I do think there's a role for kind of these hair transplant consultants, if you will. But, you know, the caveat being that they're not transplant surgeons, and so the perspective is definitely different. They're not going to be the ones to take on the responsibility of treating you, and so it's a little bit of a different perspective, but, you know, nonetheless, it's a valuable one.
Now let's talk about LeBron James. He started developing the first signs of hair loss, as you can see already here, in 2005, and it started pretty much like progressing from there.
So he's showing 2005 at 1 minute 41 seconds, and yeah, what I'm seeing here is that the anterior hairline in the center, it looks like it's still at a pretty good place. I don't see it recessed in any significant way. I mean, I'm sure it's more than when he was 18, but it's overall at a pretty good height. But you can see the frontotemporal area starting to recede quite a bit, and you can overall just see a thinness going on in the frontal mid-scalp compared to, for example, you know, this kind of parietal side part of his hair.
Like year by year, in 2008, we have seen that he's losing the definition on the corners, and his hairline also probably doesn't have that high density anymore. If we go to 2012,
yeah, so right here, I guess he's saying this is 2012. You can see that he went from a kind of a pretty natural looking peak here in the frontotemporal region to something that's a lot broader, and now it's starting to kind of create more of a hollowed appearance and more even circular as opposed to kind of a more natural point. It's starting to get kind of really pushed back even further, and then that central area starting to get more narrow.
We see that his corners are going even higher, and I think it was like 2014, we can already see him being like a really good Norwood 3 with some diffuse hair loss already starting to appear on his corners and starts to progress towards the mid scalp. 2014 was probably the last year, as we remember, like LeBron without hair on the front or with this type of thinning, because in 2015 we already can see him with a pretty defined hairline. Like that would be considered like the first comeback. Now, how can I tell for sure that LeBron James got a hair transplant? Well, this is a screenshot from a video where his barber was cutting or trimming his hair. And
oh yeah, this is a pretty telling picture here at 238. You definitely see a linear scar, which honestly that is not like a very standard location for an FUT scar. It could have been, you know, I don't know why they would have picked from there. That's not really considered the safe donor area. It's a little bit too high and too far to the side. So I don't know if that's maybe from a prior injury. But then lower down where Matt has the black kind of dashed line where you can see FUE dot scars there in that area. So I think that's an FUE procedure. I'm not sure where the red arrow is, if that's truly from an FUT procedure or if it was from prior trauma, because I think he's gotten into different accidents probably over time, just, you know, given the sport, you know, that he's in. And I think there was one incident where his head hit a monitor. I remember he had a wound from that.
Bogut, good hard foul. And James just lost his balance. And just goes crashing in. And hit his head right on the camera by the lens. LeBron James spins baseline and is fouled as he goes inside. It's been a more physical game as James goes down and holding his head.
Maybe that's from that accident. I'm not sure on that, but let's see what Matt says here.
Trimming his hair, and you can see the red arrow shows the FUT scar, like pretty small FUT scar.
Yeah, it just wouldn't really make sense. I mean, I'm sure he probably went to a really good surgeon. Can't imagine going to someone who doesn't know what they're doing. First of all, FUT wouldn't be the first choice in this day and age, and even in 2015. Secondly, that's just not a standard location for an FUT procedure. So unless they just did a smaller FUT procedure to potentially just fill in the frontalmost area instead of doing like a larger surgery, that might be possible. But yeah, I'm not completely convinced that's from surgery. It may have been from trauma.
From a previous strip surgery, and the black arrow shows us another area below the scar where we can see these small dots, white dots, which come from another hair transplant.
I agree that's from FUE.
This time FUE hair transplant.
Yeah, I agree with that.
This is like follicular unit extraction where they isolate follicle by follicle and then extract these follicles from your from the back of the head, but also from the sides, but in his case mainly from the back. I don't know which hair transplant was first or whether he got FUT and FUE combined in one session. Theoretically it's also possible, but I think he got it done one by one. I wonder why he didn't get a scalp micropigmentation on the strip scar and also on the donor area. He might have done like a 2000 to maybe 2400 graft hair transplant.
Yeah, I don't agree with that estimate. 2,000 to 2,400 would be, I think, way too high for that area that he has kind of in red there. I would put it at closer to maybe 1,200 to maybe 1,600 tops. I mean, you wouldn't need more than that, especially with very curly hair like LeBron has. I do not think he had 2,000 plus into that area. I think you can get away with a lot less than that, so I think that's an overestimate.
It was his first hair transplant, and this is the area which I think was the biggest focus, as you can see here. And the photo below here, guys, I think this is already after his transplanted hair started to grow, and obviously some additional use of concealers and hair fibers.
Yeah, keratin fibers are very commonly used by people. They definitely help kind of set the base to reduce that kind of see-throughness of the scalp. The alternative would be scalp micropigmentation. I know Matt mentioned that for using it for the donor area where the FUE scars are, or that linear scar that he has, but they can also be used at the kind of frontal mid-scalp area. It's more more effective when you already have hair there, I think, than when it's just like there's no hair and you have like a two-dimensional SMP or scalp micropigmentation tattoo there. I don't like that on like a bare scalp. Some people like that look, and that's fine. But that's another option for LeBron if he's relying on the keratin fibers at this point.
Derm match, which is something more like you apply it on your skin, and then hair fibers you apply only on your hair. So maybe a synergistic effect between like a hair transplant, hair fibers, and derm match is this photo here. Because honestly, if we look at him here, and this is from 2015 from the movie Trainwreck, this is not achievable with a hair transplant, obviously, and this is like a synergistic effect: hair transplant plus hair fibers plus like concealers, like derm match.
Yeah, I agree that the appearance of the hairline there, it doesn't look very natural to me. It looks too perfect, and I don't think it's too perfect because of a poorly executed hair transplant. It looks like there is some concealer there, so I agree with Matt on this one.
Combining all that together, and especially if you have like very dark hair or black hair in particular, it's very easy to use hair fibers to make it look natural as well. And this is his progression in his transplanted hairline.
Yeah, this is interesting. So let me take a look at this at 444. So you can see a lot of thinning at that topmost photo. Pretty impressive, yeah. And then as it's going further, I guess as time goes by, he's been getting more transplants. And yeah, I mean, I think it's helping, but you can see those kind of patchy areas that are still there. The area right in the front looks a little bit stronger, and then it just starts to get weaker as you get further back. Again, in this region right here, he did not get like 2,500 grafts. I think probably the 2,500 grafts could have been used to get a lot further back, but for some reason there's still quite a bit of patchiness.
And as you can see here, the picture number one, we see like no definition in the frontal hairline whatsoever, although I think already that this photo was already after his hair transplant, because here, the photo number two, we can see already how his hairline is thickening, and with the photo 3 and 4 we can already see a much better definition also in his frontotemporal triangle here, okay, on the photo number 4. All right, so after his first hairline comeback from the dead, we can see him with a big drawback in 2018, where he was like accidentally captured during the game with one of his teammates. Here we can also nicely see how his transplanted area was left and was like spared from hair loss, because this hair comes from the donor area, from this donor zone, which is like more resistant to DHT, to androgen action and their miniaturizing effects.
So if he only had an FUE procedure, based on where those extractions were and the fact that they didn't go onto the sides of the head, and looking at the spacings that I saw, it doesn't look like he had such a big procedure the first time. If, however, that additional area where we see the scar, if that's really from an FUT, then potentially you can get numbers, you know, close to 2,000 plus. Otherwise, if it was just those FUE areas where they took the hair, then I think he probably had something closer to 1,400 or 1,600 grafts for this frontalmost area.
Was able to be preserved or stay preserved, and he kept on thinning only behind. And this also just confirms me that he probably got only one hair transplant by that time on the front here, and he didn't do anything on the rest, like mid-scalp and crown. He was just using fibers.
I do think that that looks like the result of one hair transplant as well, so I agree with Matt on that.
These years on this area, like mid-scalp and crown. This was 2018, and in 2019 there will be another comeback of LeBron's hairline and the whole mid-scalp. You can just take a look at it.
Yo, my boy Slick Nick came through and gave me one of those grade A cuts.
Yeah, I agree. I mean, he's got so much concealer in that picture. It's pretty obvious.
Because I was looking super rough. 2 weeks? I mean, technically like 18 days without a cut. As soon as I got back, I had to sit in that chair, and that boy, woo, Ooh-wee.
So, he's very open about getting a hair cut. I mean, I wish he was just more open about his transplant journey. I think it would help a lot of people. And that again goes back to my point from many other videos as well, that I wish celebrities were a little bit more open about some of the cosmetic surgeries that they get. I understand, they want to protect their privacy, but it would help a lot of people to know that, he had a transplant or 2 or 3 and what that's done for him, so other people can make an educated decision as well.
Wee. Slick Nick, you a bad mother. Shut your mouth.
It's also quite ironic because this was like September 2019, right? And in October 2019, this incident happened when LeBron James' hair broke the internet. You can see how his teammate Anthony Davis is kind of make him aware of like some hair falling out from LeBron's hairline, and it wasn't like falling out in my opinion. It was just he was overusing so much hair fibers and concealers, and it started to like spread apart, and it just looked ugly, right? It didn't look good. Losing hair, right?
The starting forwards for both teams.
Now, some people think that LeBron was wearing something like this, which you can see here, right? Like a partial hair system or something like that. But I highly doubt that, because that would mean that LeBron had to like be constantly like shaving the whole front for this hair system.
Yeah, in this picture at 7:56, it looks like he's not wearing a lot of concealer. It just looks like he's had, 1 or 2 transplants, and I wish that it was more dense than what it is, but I guess that's how things grew out in his case.
Hair system unit to be like glued on
yeah, I don't think it was a hair system unit.
In order for that partial hair system unit to hold properly, also when the person is sweating, you need to shave that area where you want to like glue that hair system on. So I doubt that
I agree with Matt on that.
Ever like wearing a hair system, like partial hair system. I think it was just as a result of using hair fibers. Okay, so this was a little shock to his hairline. If you would ask me now how LeBron's hair could look like in reality, I would maybe guess something like this. Okay, if there are like no hair fibers, no concealers in the hair, and we can clearly see here that he also didn't get any scalp micropigmentation done, because then the scalp would look different, would look darkened. Here I think this is like most like representative condition of his hair after his 1 or multiple hair transplants. We see some thinning areas in the frontal third, we see diffusely thinning areas on the mid-scalp and crown, but very defined hairline. As we can see here, it's clearly an improvement already with his first hair transplant.
The problem is, personally, I don't think he was advised properly on the hair transplant design, especially at the hairline. The problem is it's too low. It's too low in his case, and so a lot of the hairs from the back of the head have been used up on bringing the hairline down and creating something very low. And I know that that's kind of what he theoretically wanted, but the problem is with his pretty advanced recession and thinning, it just doesn't really work for him. And so instead of creating something so low that makes him look like, he's 20 again, which he's not, it would have been nicer to give him a more mature type of look where the sides are not brought down quite as much and where the central hairline starts a little further back. But again, it takes some counseling and it takes some convincing also to tell someone you want a result that's going to be with you for the rest of your life. And now, to me personally, it looks a little bit funny. He's got a little bit of hair down here instead of having good density in an area that's a more kind of mature type of situation that he would be happy with for the rest of his life. Instead, these areas have just had scattered grafts and just doesn't look very natural or great without him having to conceal it.
He was already pretty much lagging almost any definition from his hairline back in 2013 and 14. So this first hair transplant on the hairline already gave him some cosmetic improvement, but again, it wasn't probably something what he was hoping for.
And it kind of goes back to what I've talked about in other videos, where you really want to have like a specific target zone, and the smaller you can create that target zone for the transplant at the recipient area, the more dense it'll appear and the better the overall results. I mean, that's the goal at the end of the day. It's better to have a smaller area that's very dense than like less density just spread around all over the place.
That's why he kept on using concealers and fibers additionally to enhance his appearance, and with the time, unfortunately, also kept on losing more and more hair follicles from the mid-scalp and crown. Also, if we take a look at some recent photos of LeBron James from late 2020, one would think that this guy probably had been pursuing multiple hair transplants since like 2018 and 19.
Yeah, now to me it looks like the frontal hairline is a lot more dense than it used to be. I think he still has some concealer in there. But again, they haven't really even addressed the mid-scalp area just yet with transplants. I think they're just trying to work on the frontal scalp, getting that density up as much as possible. That's still a challenge.
But it's not really true. In fact, it seems like the same hair loss progression is still intact. We can see LeBron diffusely thinning all over his mid-scalp and also vertex. From here, it seems like his crown area is also balding pretty aggressively. Who knows if this guy and how well is he going to be like keeping up.
You can see how his donor area is actually quite small and it's quite narrow. And you know, that's not great for future transplants. And it's thinned out, of course, from the transplants he's already had, but his crown is extending pretty far back and he's kind of thin in the lower kind of occipital area, which is like the back of the head, but the lower portion. So his donor area is getting more and more narrow, and as that happens, it's just going to be even harder to produce good results with the transplant, because if you take hair from the back that's sensitive to DHT, that's going to ultimately thin, and you've moved it to the front, well, you're going to lose it then in the front. So it's not about transplanting hair from one area to another, it's about transplanting hair that's resistant to the effects of DHT so that you can maintain that hair for the rest of your life, ideally.
But it's also obvious that LeBron wasn't like the most serious guy about hair loss prevention either over the last decade or so, which is something that he should have considered and he should have paid more serious attention to.
Well, I think we don't really know, right, like what he was doing for prevention. It's an assumption that he wasn't doing anything, but maybe he was. Maybe he was taking finasteride, maybe he was getting PRP, maybe he was doing a low-level laser light cap therapy. He may have been doing a number of things. Rogaine, I mean, yeah, maybe he was, and still sometimes the genetics are just too strong. And you get continued thinning and recession.
That was pretty much it for this video. That was the hair transformation of LeBron James.
Yeah, I think Matt did a nice job. I think the only point where I disagreed with him was on the quantity of grafts for the kind of anterior most frontal hairline, the area that he had circled earlier. I think that procedure, he had fewer grafts, but then ultimately I think he did have probably a total of, I don't know, I'm sure he's had at least 3,000 grafts transplanted, and some of that may have been through the FUT method, and obviously he's had FUE based on those dot scars that we saw earlier. So I commend Matt on this video. It's a lot of effort to put all these pictures together, and that's why I was like, I'm just gonna, you know, watch Matt's video and comment on that instead of doing all that initial legwork myself, because I'm kind of busy with surgery. I appreciate him doing the legwork there. Yeah, so that's kind of hopefully the surgeon's perspective, kind of gave you guys a slightly different way of looking at it. But yeah, I think Matt and I agree on most of the essential points about how LeBron's hair has been transforming over the last 7, 8, 9 years. And I'll just say that it's tough being out in the public eye and going through surgeries and recovery time from surgery and figuring out a way to be presentable still. And he's got a lot riding on not just basketball abilities, but also his appearance. All right, guys, take care.